This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everybody. Thank you for attending this webinar. Today's discussion will be on how to prevent neck and back pain from working from home. And we're going to go over a whole bunch of things, including ergonomics, posture, what you can do if you develop a problem. And we're going to even include things about diet and exercise as well. Next slide. So it's no big secret that in these times of this pandemic, many people were forced to switch their focus of working in their usual office space to actually working at home. So a significant shift has occurred where people are no longer working in their offices for obvious reasons and are now working from home. And that has brought an onslaught of different musculoskeletal problems that didn't exist before. In fact, a recent Gallup poll a couple of months ago found that 4 out of 5 people working from home have now developed orthopedic or musculoskeletal issues, one of which can include neck and back pain. 48% of people working from home have developed increased stress, anxiety, and depression. 45% have developed back pain that they didn't have before, and 71% who previously had back pain have gotten worse since they're working from home. 25% have developed neck, shoulder, and pain stiffness, and of those who previously had issues in their neck and their shoulders and their trap area have gotten worse. One of the things that can lead to increased symptoms is poor ergonomics. So our assistant physical therapist in our PT department of this hospital is going to talk to ergonomics and how correcting those deficiencies can make a big difference while you're working from home. Next slide. So the major types of health problems that can happen while working at home, as we discussed previously, is back pain, neck and shoulder pain or tightness. Another big one is eye strain and headaches related to that eye strain. Obviously, mental health issues. As we work from home, we can become socially isolated and our human contact level decreases. Sitting and staring at a computer all day long, not talking to people. It has a whole subset of issues that have become very prevalent in society right now, although albeit temporarily during this pandemic. And then other issues occur as well. Chronic knee pain from sitting all day long, hip pain from sitting a long time and hip stiffness and tightness, shoulder tightness due to poor posture sitting at the computer. And a lot of people are now developing, and we're seeing an increased incidence of wrist strain and things like carpal tunnel syndrome because of working on the keyboard and mouse and not taking enough breaks. Melissa, the physical therapist, is going to talk about that. So on today's agenda, we're going to define and discuss ergonomics. What is it and what can you do to ensure you're doing it properly? We're going to describe an optimal home workstation. We're going to talk about the role of good posture, especially while you're seated. We're going to talk about problems that do occur and then what one can do about it when it occurs. We're going to talk about the role of diet, nutrition, and exercise in combating these issues. And then lastly, we're going to talk about the importance of mind-body exercises to decrease stress, anxiety, and in some cases, even depression. So Melissa, would you take over at this point?
Hi, good afternoon, everyone. My name is Melissa Hafner. Based on those stats that Dr. Ben just presented, we do understand why talking about ergonomics is such an important part of this lecture. So what is ergonomics? Let's start with the basis. Ergonomics is the science of fitting the job to the worker, including the workstation, the work task, and the work equipment. So good ergonomics can make the job safer by preventing injury and illness, makes the job easier by adjusting the job to the worker, and make the job more pleasant by reducing the physical and mental stresses. There are many common ergonomic risk factors. Here we'll just discuss a few that directly relate to a workstation and sitting at a computer for a prolonged time. So one of the first ones is repetition or prolonged activity. So performing the same task or similar task for a prolonged time without adequate rest or breaks can often lead to discomfort and trauma. Awkward positions and poor posture, excessive pressure or force. So there are hard, sharp object leaning on our soft tissue, our nerves, our tendons, This can also lead to some discomfort. So points that can happen is if your wrists are resting on a hard surface or a desk edge while you're typing. Often we're leaning on our workstation with our elbows, or on a hard chair can be another part where we're putting force on our elbows for a prolonged time. And static posture. So the longer the uninterrupted duration of a task, the more potential for discomfort or injury. Now, if you expose yourself to one or more of those risk factors, it significantly increases the chances of experiencing discomfort. But with that being said, the good news is there are very simple ways that you can help yourself. We're going to start by talking about the importance of proper posture. So proper standing posture, proper sitting posture. When you have proper posture and spinal alignment, it really minimizes the negative forces and stresses to our muscles and ligaments. Adapting our posture to proper posture is an essential part of maintaining a healthy skeletal structure as we age. If you look at the pictures on the right-hand side, there's the correct standing posture. I like to give that visualization because you think of ears over shoulders, shoulders over hips, hips over knees, and knees over ankles. If we can maintain that posture majority of our day, we're putting ourselves in a good spinal alignment. As soon as you add a little bit of a forward flex posture, you're really increasing the workload and the pressures on the internal structures and muscles that surround it. So now we want to take that proper posture and put it into a sitting position. You still want to think of the ears over shoulders, shoulders over hips, but now your feet are going to be fully planted and supported on the floor. If you look at the sitting posture picture, the red one, we probably find ourselves in that position majority of our day. I know myself, just working on this presentation, I was in that forward flex posture, constantly correcting myself. So if we can have little tricks where we lean into the back of the chair and start thinking about keeping our head over our shoulders, it may get us more innately into that good sitting posture. Thoracolumbar support is an important part or an essential part of keeping that and maintaining that posture during a prolonged time. So there are many studies that show that with proper support to the mid and lower back, there is less stress on the cervical spine. This kind of shows the relationship is one area is in a not proper alignment, the whole system has to work a lot harder. So what is good sitting posture? We all want to achieve that, but it's not so easy all the time. Depending on what kind of chair you're working with at home, you may have to be a little more creative than someone that has a nice ergonomic or office chair to work with. To me, out of all of the workstation and the adaptive equipment there is, I think an ergonomic chair might be one of your best investments if you're going to be more working from home for a longer duration of time. So let's start with the backrest. I believe that's one of the first things you should address. I want your back and your hips should be all the way back in the chair, leaning fully against the backrest. The backrest should support the natural curve of your lower back. Once you're leaning into that and it feels comfortable, some chairs may offer a little bit more lumbar support than others, and that's where you can play around with towel rolls or purchasing a lumbar support pillow, depending the needs that you, depending the kind of ergonomic chair that you have. With that, you want your head upright and straight over the torso. The shoulders should be down at your side and relaxed. If you do have the arms on your chair, you want them at a height where your elbows could be comfortable at your sides and about 90 degrees. You want to picture your elbow, your forearm, and your wrist all parallel to the floor and in a neutral position. Most of these chairs, these ergonomic chairs or office chairs, do have the ability to adjust. So again, you want to lower that chair so that your hips are at 90 degrees. Your knees should be, or your backs of your thighs should be supported. Your knees should be at 90 degrees and your feet should be fully on the floor, nice and supported. If you don't have a chair that raises or lowers, you may have to play around with a footrest, maybe some textbooks, but overall your feet have to be fully supported. To me, good sitting posture is really the basis of an ergonomic workstation. Once you achieve this good sitting posture, now you want to bring it into your workstation. Okay. So now that you're in this good sitting posture, you really want to rearrange your workstation around this good posture. Apologize. Okay. So let's start with the monitor. The top of the screen should be really at your eye level or slightly below your eye level. This allows you to view the screen in a downward slant with your eyes, so you're not always straining looking up. Your eyes should be slightly downward, viewing the middle of the screen. The position of the monitor, you really want about 18 to 20 inches away, roughly about an arm's length away. This allows you to view your screen without a lot of neck and head turning. Keyboard and mouse, we kind of reviewed where the arms should sit when you're in a sitting position. You really want that keyboard and mouse to meet up with your arms resting comfortably at your side. Your forearms should be supported and parallel to the floor. Your wrist should be in a neutral position, not bent. And the mouse should be close in a close proximity to the keyboard so you're not reaching or overexerting. The chair height, we did describe a little bit in the other slide. If it is adjustable, you want to promote that 90 degrees at your hip, 90 degrees at your knee, and the feet resting flat on the floor. Inherently, many of the ergonomic guidelines for computer workstation arrangements assume that you'll be using a desktop system where the keyboard is separate from the monitor. I do believe that a lot of people are working from home on a laptop, which isn't ideal. Inherently, the laptop design is pretty problematic. When your monitor is at a good height, a lot of times the keyboard is not. So this is one system that sometimes you need to purchase either a laptop riser, a stand, or a detachable keyboard. So in this picture on the right, this person has the laptop riser, which now has put the monitor at a very good height for viewing, but that keyboard is not typical that you can type on. So the detachable keyboard has offered her that ability to stay in a good ergonomics. So this day and age, there are many ergonomic products that are available on the market to help improve the comfort of your workstation environment and to promote spine health. These are just some examples. There's many different types of keyboards, wrist rests, mouse pads of different thicknesses depending where you need the mouse adjusted to, adjustable chairs and desks, which when you looked at that workstation, having more adjustments allows you to able to adapt it to your needs. Glare screens, sometimes by the end of the day, you might be straining your eyes or getting headaches. Sometimes you could play around with the glare screens. Headsets are a nice option for someone that has to use the phone majority of their day. This allows your hands to be free. So when you're multitasking, you're not trying to hold the phone with your ear and shoulder. Sit-to-stand workstations, I think, really have become more popular. Even corporations nowadays are investing money and time into these sit-to-stand workstations, because if you look at that picture to the right, you really see that these sit-to-stand workstations offer a seamless transition from working in a sitting position into a standing position while keeping good ergonomics. I think people have picked up on that there's a wealth of health benefits when you can change your posture throughout the day. And supports we talked about a little earlier is without proper support in the lumbar or thoracic area, it can affect the whole ergonomics of your workstation. So there are many different types of supports depending on the size and firmness you need. Just like anything else, I would tell you to do your research before you purchase any of these products. There are specific ergonomic stores that versus just ordering on Amazon, but you can go into these stores and the people in them are pretty knowledgeable that they can give you some insight of what might be best for you. So while you think you have your workstation set up, you might have some ideas of how to correct your sitting posture. There are other things you could do during your day to help break up your day from that static posture. So eye breaks every 15 to 20 minutes. You really want to try to briefly look away from your computer to a more distant object or scene greater than 20 feet. This allows your eyes, the muscles in your eyes, to relax a little bit. You can also try some rapid blinking that refreshes the tear film and also gets any dust particles that may be resting on the eye. It's the 20-20-20 rule. All right, resting breaks. You want to try to throw in a rest break every 30 to 60 minutes. At this, you want to get up, stand up, move around, maybe go get a glass of water, a cup of tea, just use different muscles than you were using sitting down. This really can promote circulation and helps the muscles feel a little less tired by using different muscles. Gentle, exercise breaks, I apologize. Exercise breaks, you do want to try every 1 to 2 hours, taking a little longer of a break and doing a little more exercise. So there are some gentle stretches that you can do, or even just maybe getting a little more endurance in, so you might go for a walk. Move more and sit less. You really want to try to get out of that static posture. With these exercise breaks, you may think, how am I supposed to fit all this in my work day? Well, typically, if you were going to the office, you may have had to get out of your car, walk to your office. There may be a few times during your day that you've gotten up to go to the photocopy machine or talk to a coworker about an issue. Your bathroom or your restroom may have been further down the hall, so you were sneaking in exercise during your regular work day. Now that you're home, your environment's smaller, and you may just get stuck in that one position longer than you typically were. The last, the ergonomic software we have it at work here, and I think it's gained some popularity because when you're working on a computer for a prolonged time, it's almost hypnotic. You forget how long you've been sitting in that same position. Well, there is this ergonomic software that is available. It'll monitor how much you've been using the computer, and it'll prompt you to take rest breaks at appropriate intervals, and it'll even offer you some guidance and some gentle stretches that you can do. So if you're not familiar with stretches, this might be a nice way to educate yourself in some of that as well. Exercises and stretches. There are many gentle stretches and exercises that are available for you to perform during your break. These are just some examples of typical stretches on joints and muscles that may have gotten stiff from being in that prolonged position with computer use. No matter how ergonomic your workstation is, stretching the body and changing your position can help prevent the health issues that may arise with prolonged positioning. But just with anything, you do want to go into your stretches very slowly and see what feels comfortable on your body. If anything's uncomfortable, you should always hold off and ask a physician. With that being said, overall, improving your workstation and your health can be as simple as making time for some gentle stretches, varying your posture throughout your day, investing in some ergonomic products, or just adjusting your workstation and your posture in your chair. Whatever you choose to do, you really want to keep your back and neck in mind during your day, and it'll infuse a little bit of health in your day by possibly preventing future pain. With that being said, I'm going to turn it over to Dr. Ben, and he's going to discuss the types of problems and conditions that can occur. Thank you.
Thank you, Melissa. That was excellent. So as we're moving forward, let's take a minute or so to just take a look at this index that we use in clinical practice. If you just take a look, there's about 12 questions, and just kind of jot down in front of you how many you checked yes to. We'll wait about 60 seconds for you to take a look at that. This is a tool that describes function. So as you're sitting at your desk and you're working all day at home, a lot of people, and some estimates are as much as 60 to 70% of the population who have moved to working at home and sitting at their desk all day long, have started to develop or exacerbate previous issues with their neck and back, tightness in their hips, their knees, their trapezius area, have developed some headaches, and we'll talk about that in a little bit as well. So this is a functional tool that we use in clinical practice, and I just want you to go ahead and score it, and then just keep in mind how many you checked yes to. So we'll wait another 30, 40 seconds, and then we'll move on. As you're doing this, we'll give it another 15 seconds. I'm going to refer to this at the end, and then I'll ask you to take a look at your score, and I'll help you interpret what it means. Okay, let's move on. So what kind of health issues can occur while you're working from home and you're sitting at your desk, you're slouching like this with your posture, which you don't even know that's happening, that Melissa covered very well. But some of the things that can happen are mechanical neck and back pain or stiffness, muscular pain or myofascial pain. You get tightness and things called trigger points. You can develop postural faults. One of the things that she showed you in the slide was when someone was sitting, their head was forward, they're slouching while they're working on their computer, and it kind of looks like this. And that puts a lot of strain in the neck area and in the trapezius area, and even in the shoulders because you're kind of hunched over. So that's why it's more important to be upright like this and to follow her guidelines as far as proper ergonomic seating posture. Postural faults can develop muscular issues, and then orthopedic issues very commonly can get exacerbated, such as in the knee, the hip, the shoulder, and we talked about the wrist. One of the things that most people don't talk about is the eye strain that can occur. When you're staring at a computer that has an LED screen all day long, the LED screen, and it could be a television as well, produces blue light. Blue light's part of the electromagnetic spectrum, but blue light has a significant effect on your retina, and it can also upset your circadian sleep rhythm. So that can cause a lot of issues, because if you're not getting proper sleep, coupled with the fact that you're sitting at your desk all day long, and now you're getting eye strain from blue light, it can affect your sleep, and now you're affecting your sleep. That too can promote musculoskeletal problems. And lastly, one of the biggest things that we've seen in this post-pandemic era is mental health issues. A lot of people from social isolation are developing anxiety, stress, and depression. And Caitlin, our nurse practitioner here at the Back and Neck Pain Center, is going to talk about some tools that you can use to help overcome that and mitigate some of those things. Next slide. So I'm not going to talk a lot about this. I just wanted to show you some common pain generators. If you look up on your top left-hand side of the screen, that's pointing to something called a facet joint. So those are the joints of the spine. They're highly innervated with nerve endings. And if you're sitting all day long in poor posture, that joint can become strained. It triggers pain sensation through that joint, and then that can trigger reflexively a muscle to get tight, and then it becomes a vicious cycle. So you can develop something called facet syndrome or joint pain in your back. Likewise, there's something called the sacroiliac joint, which is the joint on both sides of your back between the iliac crest and the sacrum, your pelvis essentially, and you can see it's pointing to the sacroiliac joint, a very common reason for back pain too. And if you look down on your bottom left-hand screen, it's what I referred to before, something called a trigger point, which is a knot that develops in a muscle. Muscle can be very tight, can become very stiff. This is the area that really common for developing what we call trigger points or contraction knots. And if you go behind someone's neck and you touch it, you can actually, it almost feels like a marble. And those very commonly occur, especially as your posture is anterior or forward. Those muscles are trying so hard to get you in an erect position that they now strain, they become tight, and then they eventually develop those little red things that you see called trigger points, which are really nothing more than a muscle, a part of the muscle that's contracted. Other things that can happen if you're sitting a lot and not taking stretch breaks and moving around, and that's why Melissa talked about sit less, move more. As you sit, the discs between your vertebrae, they compress. And a disc is like a jelly donut. So if you're sitting all day, that jelly donut smooshes down, and you can see it's pointing, the pointer's referring to a herniated disc or a bulging disc. And as you sit more and more, research has clearly shown that sitting increases the intradiscal pressure, and now that can pinch a nerve as well. So these are common things that can happen from sitting all day. Next slide. We talked about eye strain. The 20-20 rule is really what I want to touch on, because every 20 seconds that you're looking at a monitor that's emitting this blue light, what I'd like you to do is just take a 20-second break, stare at something 20 feet away for 20 seconds. So that 20-20 rule, 20 feet away for 20 seconds, will help you attenuate and mitigate the effect of blue light on your retina and effectively decrease the effect on your sleep pattern and not disturb the circadian rhythm that allows good sleep. The other thing you can do, which is inexpensive, is you can buy if you don't need prescription eyeglasses, you can certainly buy a set of glasses that have a blue light filter in them, and they're not very expensive. Or the next time you get a new prescription filled out, you can actually ask your optometrist to put a blue light filter inside your prescription glasses. The other thing that can happen is eye strain from not blinking as much. When we tend to stare at a computer for a long time, we don't blink as much. And if we don't blink as much, our eyes can get very dry. And sometimes just using some over-the-counter drops actually help that as well. So eye strain, in the way we just described, can actually cause your muscles to get very tight, can disturb your sleep, which could actually lead to more musculoskeletal issues. We talked a little bit about mental health, how being socially isolated, working in your house all day long can cause stress, anxiety, and depression, decreased social contact, which leads to a sedentary lifestyle. And a lot of people, when they're working from home, develop the inability to separate their work and personal life. And work becomes their whole life. They don't break for lunch. They don't take stretch breaks. They don't take breaks to go exercise. When you're working from home, those things become critically more important than when you're actually working in your usual office space. Next. So we'll talk briefly about some things that you can do if you've developed some issues. We'll talk about modern day chiropractic medicine. We'll talk about physical therapy and acupuncture and massage therapy, which won't be the focus of today's discussion. At our Back and Neck Pain Center, we now offer acupuncture. Many clinics offer acupuncture and massage therapy, and those are all good things to reduce stress and pain as well. Next. So here's some general pictures talking about physical therapy and some chiropractic medicine. I'm going to talk a little bit about chiropractic care. Melissa will come back and discuss some of the roles of physical therapy. Both of these are excellent therapeutic modalities to help with stiffness, pain, and things that develop from working at home, from poor ergonomics and poor posture. Next. So chiropractic care, I'm a chiropractor practicing now for about 37 years. I have a lot of experience in seeing these kinds of things. I'm just going to touch on what chiropractors do. Chiropractors do spinal manipulative therapy. The top left-hand picture shows, and if some of you who are watching have been to a chiropractor, this might be something that you've gotten in the past. The guy on the right is holding a tool, which is a mechanically assisted way of manipulating or mobilizing a facet joint. And then on the bottom picture, the gentleman in the white jacket is Dr. Cox. He developed this Cox table, which actually moves in every different direction that your body does, and it can gently mobilize the joints without doing that high velocity crack manipulation. And it also decreases the disc pressure as his hand moves up and down. You can see the picture on the right, the table's lower, and he's holding the disc. That actually helps to restore normal joint function and restore normal disc function. Chiropractors also talk about exercise and also recommend nutritional therapy, and we'll actually talk about that a little later with our nurse practitioner. Next. So here's the doctor actually performing a Cox technique treatment. He's holding the spine with his right hand. His left hand has a tool that will actually push the table down, and it actually moves the joint and actually decreases the intradiscal pressure as well. I use this a lot in my practice. I have about 4 or 5 of these tables. It actually is very effective at reducing disc pressure, and it's a very conservative way of actually preventing spine surgery because it actually decreases the protrusion by creating centrifugal force, which means pulling the jelly back into the middle. If a disc is like a jelly donut, picture the jelly being from the middle out to the side, pinching the nerve. This technique actually helps to pull the jelly back into the middle. Very effective, about an 85% success rate. Next slide. So I'm going to give it back to Melissa. Melissa is going to talk quickly about physical therapy and how physical therapy is a big asset in treating these issues as well.
Hi, thank you, Dr. Ben. So Mather Hospital has been servicing the local community for over 30 years for physical therapy. It is another conservative approach to trying to handle some of the dysfunction or pain that you may experience from using the computer. So on your first session, a licensed board certified physical therapist will take you through a thorough evaluation of your pain and dysfunction or any other complaints you may have. A thorough postural sitting and standing assessment will be performed. This is where we can pick up on a lot of areas that we can work on for you. We'll check your strength and range of motion as well. we can perform, and we have performed, nice detailed assessment of your workspace. So we've done this virtually, where someone has allowed us into their home via the computer, or many of our patients will come in with their workstation with a picture on their cell phone. So they'll have a picture of their workstation, their chair, and then a picture of them sitting in their chair. And this allows us to offer a little feedback where they can modify, or we can make suggestions that they can improve their workstation a little bit. Once you are evaluated, based on the findings of your evaluation, there are many techniques that we can do to reach our goals. Therapeutic exercise, many of you may have been to physical therapy in the past and may be aware of some of the exercises that we do, but therapeutic exercises focusing on stretching and strengthening of the core and postural muscles will help improve the flexibility and stability of the spine, therefore overall improving your posture. We do focus on some endurance exercises, because prolonged sitting does require some endurance in those muscles that support the spine, making it a little easier to maintain that correct posture throughout your day. Manual therapy, we often use soft tissue mobilization, myofascial release, and manual stretching, depending on what's found on the evaluation. We do have modalities such as heat, ice, electrical stim, ultrasound, and traction. And then once we've reduced your pain and improved your strength, we try to look at the functional activities that you may have avoided or stopped doing because of your pain and dysfunction. So we'll ask you some things that you want to get back to, and then we set those as some new goals. We do implement a home exercise program. We feel that that's important for maintaining and preventing future reoccurrence for patients to get comfortable. It also gives patients an ability to get comfortable with their exercises while they're still under our care, so we can critique their body mechanics and their form as they're doing these exercises, in hopes that in the long run, you would continue these exercises when you're done with therapy. And then postural patient and postural education is a big component of physical therapy. We allow the patient to take ownership of their life and their pain and make some lifestyle changes for them to use for the future. So sometimes when you educate a patient on why they're doing something, they'd be more apt to do it if they understood why and what we're trying to prevent. After that, I'd like to just turn it over to Caitlin, who's going to talk about the Back and Neck Pain Center.
All right, thanks, Melissa. Hi, everyone. I'm Caitlin Conville. I am a family nurse practitioner, and I'm the nurse practitioner navigator and care coordinator here at the Back and Neck Pain Center. Today, I'm going to tell you a little bit about our GPS system at the Back and Neck Pain Center and how we coordinate your care and guide you throughout the treatment process if you do come in for treatment. So during your first appointment, I review all of your prior records, take a thorough history, and then we also conduct a physical exam that's focused on your back and/or neck pain and your specific concerns. I address any needs for medication and or diagnostic imaging at the time of your initial appointment, and then I present my findings to our multidisciplinary clinical care team, which is a team that meets once weekly to discuss all of the patients in our program and includes providers in pain management, spinal surgery, chiropractic, and physical therapy, so that we can discuss your case and select the best treatment plan for you. We also help to coordinate your first appointment with an appropriate provider, whether that be a physical therapist, an interventional pain management provider, a chiropractor, or a spinal surgeon. We will then schedule follow-up appointments so that we can monitor your progress throughout the course of treatment and review diagnostic imaging findings, discuss your diagnosis, and help you to understand the treatment options available to you. How is the Back and Neck Pain Center different? So here at the Back and Neck Pain Center, we provide evidence-based multidisciplinary care, which is customized by the clinical team and the collaborating physician and guided by a nurse practitioner, which is me. When I mentioned multidisciplinary care, I'm referring to the fact that we have multiple providers from many different disciplines, as I mentioned earlier, including spine surgery, interventional pain management, physical therapy, and chiropractic, who all work together to coordinate your care. So at the Back and Neck Pain Center, we aim to reduce recurrent episodes of back and neck pain in the future by teaching about adopting a healthy lifestyle, such as diet and exercise, which I will also talk about a little bit later. We also avoid the use of high-risk pain medications. One of our goals is to alleviate your pain, but we want to find the underlying cause of your pain and provide treatment that addresses this underlying cause. We also identify and address disparity of care factors. Now, there are many factors that make it difficult for individuals to access treatment, including financial obstacles, transportation issues, mobility issues, comorbid medical conditions, mental health issues, and difficulty managing multiple appointments with different providers. So here at the Back and Neck Pain Center, we aim to identify these factors and provide assistance to ensure that you're able to get the treatment that you need. Okay, this graphic depicts our approach to treatment at the Back and Neck Pain Center. It's our step-ladder approach. With this approach, we aim to provide the least invasive, effective treatment option for your condition. So for most people, this means starting with conservative treatment measures such as physical therapy or chiropractic care. Now, if you have already tried conservative measures without improvement, or if your condition warrants further intervention, we may start a little bit higher on the ladder with interventional pain management or one of our support programs, such as our Healthy Diet, Healthy Spine program, which addresses nutrition as it relates to spinal health. In cases where you have a red flag sign or symptom that indicates an urgent condition, we may send you directly to a surgeon. So approximately 75% of our patients improve with conservative measures, but we continue to evaluate you throughout the course of treatment and recommend additional treatments or steps as appropriate. About 20% of our patients utilize our pain management treatment options, and then about 5% of our patients have required spinal surgery. Our overall goal is to provide the most appropriate treatment for you and treatment that will be effective in reducing your pain and will help you to regain function. All right, now I'd like to talk to you a little bit about the role of diet, nutrition, and mind-body health in the reduction and management of pain. So on the left here, we have an example of foods that are not the healthiest foods in the world. So foods that promote inflammation in the body and promote weight gain while providing very few nutritional benefits. On the right, you can see fresh, colorful produce that are high in antioxidants, vitamins, and minerals, and serve to reduce inflammation in the body. So research shows that our diet plays a significant role in inflammation and pain in the body. Inflammation is an important underlying mechanism for the development of chronic diseases such as type 2 diabetes, heart disease, arthritis, and cancer. And increased inflammation in the body is also found in patients with chronic pain. So by recognizing the foods that can reduce inflammation, such as plant-based foods, as well as those that promote inflammation, we can make dietary modifications that can decrease inflammation in the body and can help to reduce your pain. All right, the anti-inflammatory diet. So as I said, inflammation in the body can either positively or negatively, positively or negatively affected by the foods that we eat. So pro-inflammatory foods, or foods that increase inflammation in the body, include saturated fats, which are found in meat, especially red meat, and whole fat dairy products. There are trans fats, which are found in the hydrogenated oils used to make processed or packaged baked goods and crackers. We have omega-6 fatty acids, which are found in oils such as corn oil, safflower oil, soybean oil, and sunflower oil. And we have sugar and sugar-laden foods. So some anti-inflammatory foods that can help reduce inflammation markers in the body include omega-3 fatty acids, such as canola oil, walnuts, and fish, monounsaturated fats, which are found in olive oil, peanut oil, nuts, or avocado, fruits, vegetables, and whole grains. The more colorful, the better, and many different herbs, spices, and teas. So on the left here, we have the food pyramid. Sorry, we just go back a slide. On the left here, we have a food pyramid for the Mediterranean diet, which is an anti-inflammatory diet and provides an excellent guideline for how to make diet modifications that will reduce inflammation in the body. We can go to the next slide, thanks. So Healthy Diet, Healthy Spine is one of the support programs here at the Back and Neck Pain Center, and it promotes dietary changes and healthy weight management in order to reduce inflammation in the body and support spinal and overall health and wellness. So with this program, you can have a consultation with a registered dietitian and discuss the importance of managing weight and how it relates to pain, develop a meal plan focusing on anti-inflammatory foods, and review the Mediterranean diet a bit more in depth and learn how to implement its recommendations into daily practice. So mind-body tools to promote mental wellness. As Dr. Ben-Eliyahu discussed earlier, working from home and experiencing pain can cause increased stress, anxiety, and depression. Focusing on one's mental wellness is an important factor in reducing pain and addressing mental health issues such as stress, anxiety, and depression. So on the right, we have a depiction of yoga poses that you can perform right from your office chair. So these are great. You could put these into practice. You can even look them up on the internet for some additional ones. These are things that you can do right at home just to help reduce some stress and anxiety. And on the left, we have a depiction of body scan meditation and some of the benefits of body scan meditation. So you can see that with body scan meditation, it's just a brief pause that you take to meditate, take a nice deep breath, and you really focus on all of the different parts of the body one at a time, and be in the moment in that body part as you're thinking of it. So there are numerous mental health and physical health benefits to integrating meditation and yoga into our daily practice, including reduced pain, reduced stress levels, and improved sleep. So I do recommend implementing both of these into practice. All right, now I'll hand you back to Dr. Ben-Eliyahu, and he's going to discuss the results of your risk assessment.
Thank you, Caitlin. So back a little while ago, we had you do that risk assessment tool, and if you scored it, typically if you scored, there were 12 questions. If you scored 2 or 3 or more, that usually indicates that you are having a functional disability, meaning that you could be developing headaches, neck pain, back pain, stiffness in those areas related to your workstation and related to this increased working from home situation during this pandemic. So if you scored more than 2, that means that the functional deficit is definitely affecting your life. If that's happening, you could try some of the things we talked about, but I would urge you to call the number and actually be assessed by Caitlin. We can do that physically in person. We could even do a telemedicine. We're doing a lot of telemedicine visits with this pandemic, and Caitlin is more than happy to accommodate anybody that's watching this that's having issues and doing a telemedicine visit, or actually seeing you live in person, as we are still seeing people. You know, one of the things we talked about before is, you know, as we assess you and as Caitlin assesses you, most patients that we see, we either navigate to physical therapy or we navigate to a chiropractor. And our chiropractors is about 30 in our program that we refer to. That's generally, these chiropractors have been vetted by the hospital as high quality chiropractors. We integrate with them a lot and collaborate with them a lot. And those decisions are based on a patient-centered decision, and also the geographic location of where you live. So we can pretty much make a decision together as far as what type of treatment you might need, what you need to do. Our physical therapy department is more than capable of talking about ergonomics one-on-one with you. And there are a lot of things that our program is unique about. The main one, which Caitlin talked about, is the fact that it's integrative and collaborative. You don't have to go to 6 different providers to get 6 different opinions, because we have a bunch of different providers sitting at a desk and around the table looking at everybody's case together, deciding what's best for that patient. And we do that in an evidence-based fashion based on the current research and also based on what's best for our patient. We accept most insurances. So if you score 2 or more, I urge you to go ahead and consider calling us, and we're happy to help you. We've been practicing in this scenario for about 4 or 5 years now, and we survey most of the patients that we see. And actually the N number is a little low. We need to update that. But as you can see from some of the statistics, we've gotten some very good ratings. Most of the patients that we see are extremely satisfied with how we take care of them. And I think if you needed help and you came here, I think you would have the same experience. So next slide. So for more information, you can email me or Caitlin at that particular email address at math.bnpc@northwell.edu, or simply just call the number on the screen. Our central scheduling department would be more than happy to help you. You can email us, you can call us. We have a high success rate of helping people. Our physical therapy department is excellent at guiding people through ergonomic situations. And from a therapeutic point of view, all the providers that are on our collaborative team, and that ranges from all the different specialties that Caitlin discussed, have very high satisfaction ratings with all the patients that have come through here over the last 4 or 5 years. I hope you all enjoyed this seminar and this webinar. I believe it was extremely informative and very timely, and we'll now take questions. So if we're going to, to ask a question, you can see on the bottom of your screen, there's a Q&A session. Just go ahead and open that with your mouse and your cursor and type in the question. So we'll stay online for a few more minutes if you have any questions.
So Dr. Ben, we actually have a first question here, and it says, can you explain sciatica pain? And Dr. Ben had actually gone into this in another webinar, so he can definitely answer you here. And we actually have an entire other webinar where he goes into a lot more detail that you can find on matherhospital.org/HealthyU.
So that's great. So we did a whole dedicated webinar on sciatica, and you can find that on our website. And Emily just described how you can get there. But if Emily, you go back to the pictures of the different anatomical areas, I can take a quick moment to explain that. There we go. So on the bottom right-hand side of the picture, you can see that they're showing you in the red area that's shaded where the sciatic nerve actually is. So the sciatic nerve is formulated by the 5 lumbar nerves on that particular side that go all the way down the leg. So sciatica generally does not refer to back pain or pain just in the buttock area. It has to be pain that's traveling down the leg. So you can see that in this red stippled area that the patient is developing pain all the way down the leg. So what can cause that? There are multiple reasons, The most common reason is a herniated disc. So here you can see, I just put an arrow. You can see that that disc is very different than the one above it, where there is no protrusion of the disc. So in this particular case, the disc is kind of bulging outwards. It's pressing on that yellow nerve. That yellow nerve contributes to the sciatic nerve. And as that nerve gets compressed, it can actually cause pain down the leg. That's probably the most common reason. The other reasons are typically spinal stenosis, which tends to happen in older people due to arthritic change in the spine. And then lastly, there's a muscle deep inside the buttock called the piriformis, and the piriformis muscle can actually cause a pseudosciatica and develop the same set of symptoms. And that's because the muscle is actually pinching the nerve. That's more common in people who sit a long time and very common in runners who develop that. But that's just another case of sciatica. You can also get leg pain, but it's not true sciatica, from the sacroiliac joint that can cause pain in the buttock or the thigh, usually not past the knee. And the facet joints, this joint can actually cause pain into the thigh as well, but the facet joint generally never really crosses the knee. When you have pain going all the way down your leg, numbness, tingling, foot pain, weakness, that's typically sciatica due to a herniated disc, and that requires treatment. Any other questions? Well, I hope everybody learned something. We'll wait another few seconds for any other questions from the other people that are still logged on. And if you have any questions you didn't think of, you can take a look at that last slide. Just jot down that email address or jot down that phone number and reach out to us. We're all more than happy to help, whether it's Caitlin, Melissa, or myself. I believe there's one more question.
What are some of the physical therapy exercises that you would recommend to somebody who's experiencing back pain from work-related pain?
That's a pretty vague question. Again, there are a slew of possible reasons for that back pain, so a thorough assessment would be needed. But, again, postural correction may, if you can decrease your symptoms with some of that, it may be good. If not, you could always come in for an assessment, and I can further give you information. Like I said, there are some general stretches and positioning that can often reverse some of the prolonged posture, puts pressure on the lower back. Again, there's a herniated disc, bulging disc, tight muscle groups. So again, it's a very vague question, very difficult to answer without actually seeing the patient. So I do apologize, but I don't feel like I can answer that thoroughly right now. Dr. Ben, do you have any insight? Yeah.
Repeat the question.
What are some of the physical therapy exercises you could do if somebody is experiencing back pain?
So I mean, I think Melissa's correct. It really depends on the particular person. Physical therapy and chiropractors individualize everything. So it really depends on the situation. But in general, if you're at home, getting out of your chair and just doing some stretches, like Melissa showed you in that one slide, getting on your back, laying on the floor, bringing your knees up to your chest, doing pelvic tilts, some pelvic bridges. These are all things that you can find, online, that Melissa can also go over with you if you actually go into physical therapy. Just gentle stretches, but it really depends on the individual particular medical problem, as Melissa said. Like, for a herniated disc, those sets of exercises will be much different for someone who just has muscle tightness or a trigger point in their piriformis muscle, for example. Poor posture, if that's what's causing some back pain just from slouching all day long, there are certain things that are very different from the other two conditions I just mentioned. So it really is condition dependent, but in a general sense, some simple things are pelvic tilts, pelvic bridges, bringing one knee up to your chest, the other knee up to your chest, as long as they don't exacerbate your back pain and it relieves some of your back pain. Those are simple things that you can do at home.
Okay, great. Thank you everybody for joining us today. Once you exit the webinar, you'll see a link to complete a brief survey. If you could please complete that survey, your feedback is extremely important to us and it helps us plan our future programs. Thank you, Dr. Ben, Caitlin, and Melissa for joining us today and presenting this great presentation. If you'd like to view any of our past HealthyU webinars, you can find them at www.matherhospital.org/HealthyU as in university. Have a good day.